Good evening, and welcome to the May Public Works and Transportation Committee. I'm the chair, Councilman Vash Turner. We'll start off with introductions.
This is Michelle Harley. I represent the 4th Councilmatic District.
Anyone else?
This is Charlotte Barnes, Director of Human Resources.
Kelly
Council-
Williams, Commissioner of Public Works.
Councilwoman Oliver, are you there?
Tanya Washington, Mayor's Chief of Staff.
I'm sorry, I had some Councilwoman Xanthi Oliver, 3rd District.
Thank you, Councilwoman Oliver. Welcome everyone. Is Commissioner Williams also on the line?
I sure am.
How you doing, Commissioner?
Good, thank you.
All right. So today we're going to have a presentation from the Human Resources Director Charlotte Barnes and also Director Kelly Williams, discussing about our COVID update, some of the things that we have been doing as far as the COVID pandemic, as far as PPE and other protections for our employees. And who's here to present that?
I will be presenting that, Councilman Turner.
Thank you, Ms. Barnes.
So what you see before you will be a presentation, just trying to answer a few of the questions that you did pose. But I also did submit to the body the COVID-19 protocols that we have distributed to all department heads, all departments, and all employees. Next slide, please. Okay, so one of the questions was what we were doing, what have we done in and around employee education as it related to COVID-19. So on March 12th, we distributed some frequently asked questions that outlined leave that would be provided to employees, outlined some basic, it answered, like, I think it was about 19 questions that we thought employees would have in and around COVID. What to do if I have a family member, what to do if I test positive, what to do if I've been exposed, who should I call? All of those questions were addressed in the frequently asked questions that was submitted to employees back on March 12th. That information was revised and updated and sent out on March the 16th. To provide additional information to employees, basically providing them guidance and things of that nature around any questions they had, who they should go to. On April the 3rd, we provided additional guidance to not only employees but department heads, and that's the COVID-19 protocol document that was provided to council. So we gave some direction to department heads so that there was consistency with how the city approached and handled all of our COVID-19 matters, particularly for any employee or individual that was testing positive. So we provided guidelines for the directors as well as the employees, so there will be one central point of contact through the authorities from the city on getting information on how we should handle COVID-19 matters. As it relates to additional education, we've provided signage and posters throughout all of our facilities, whether we started that back in early and mid-March. If you enter the building now, you'll see it was notices to the public, letting them know that they couldn't enter the building if they were displaying signs of COVID. Right now, you'll see the the mask requirement, that you can't enter the building without a mask. We've also, in all of our rest areas and various places throughout all of our workspaces, you'll find signage for the employees that lets them know, cover your cough, wash your hands. So we've done a lot with providing visual cues. We limited the number of people in the elevator, so you'll see all of the signage associated with that. And so, like I said, we sent out additional protocols once we started to experience employees testing positive. So we had our first positive employee back in mid-March, and I met with the workforce impacted, that those employees that were impacted. I personally met with the workforce that day. And actually, for every other employee that has tested positive in the workplace, that had been in the workplace, I have met with the affected staff, provided guidance, let them know exactly what we were doing to address any of their questions and/or concerns. So I think the employee education has been, we've tried to communicate early and often. And if we weren't answering their questions, they certainly were calling us, proactively calling us, whether it be the medical dispensary, whether it be their respective department heads. But the mayor's office was very clear that we wanted to speak with a single voice as it related to COVID. So most of the questions, comments, concerns were all being funneled through HR. I'll go to the next slide, please.
Thank you. Before you move on, I'd like to recognize Councilman Adams and Councilman Congo. I'm sorry, Director, you can go ahead.
Yeah, thank you, Mr. Chair.
So what measures have been taken? I think the question was what measures have been taken or preventative measures have been taken to keep our employees safe. So obviously city government has to continue to run and provide services, and to the extent possible we have encouraged social distancing, but the reality is that is not going to be able to be accomplished in all instances. But in those instances where it cannot be accomplished, we have taken preventative measures. So whether it is in public works, even in our police department, we've reduced the number of people in a vehicle. So the police department has gone to one officer vehicles, and where practical and possible, public works has gone to one person vehicles. All vehicles have been stocked with disinfectant wipes, with hand sanitizer, and other disinfectant measures, and the employees and gloves, and the employees have been instructed to wipe down their surfaces, social distance, things of that nature. As it relates to sanitation, we modified how they arrive at their workplace. As you well know, it typically was 3 people to a vehicle, the driver and the 2 truckers. The driver is in the cab and the truckers follow. Supervisors are now taking them to their work site, and then they're on the truck that way, making sure that to the extent we can that we're keeping distance as much as possible. There's no way that we can do sanitation without having individuals come in close contact with each other. We have routes, but we would have to have vehicles for each of those individuals that are truckers to follow behind them. And as you can imagine, that would be not only a transportation nightmare, but it would be a logistical nightmare as well. We just don't have the resources to do that. But we have taken every possible measure that we know of to make sure that our employees are have been protected and safeguarded to the extent possible. If an employee in an area or a workplace tested positive, we disinfected the workplace. I will say that the public works yard has been disinfected probably at least 3 times that I can count, if not more. I do know that the city county building, the entire building was done back in March when we had the first, positive employee. And as we've had additional employees, we made sure that the areas and their workspaces and their departments were disinfected with the special COVID-19 products that Public Works has secured. So those are the measures that we have taken to try to make sure that employees are safeguarded. We have also distributed masks, particularly with the governor's requirement for face covering. Before there was a requirement for face covering, Public Works and certainly police and fire were distributed masks to use. But since the governor's face covering requirement for those individuals that are not working remotely and in the building, we have distributed masks. We have daily screenings as required for everybody that's coming in the buildings. Their temperatures are taken. They are given a COVID questionnaire to see if they should be admitted to the building. And if they don't have a mask, they're presented with a mask. We have the department heads know that we do have additional masks that can be distributed because we know that it's a requirement. And the city has received donated masks from, I believe it's the U.S. Conference of Mayors. Chief of Staff could clarify that for me. We received donated masks from them. We've purchased some cloth masks. We have the surgical masks that we have been distributing, and I just distributed them to a department today. HR has all of that, all of the equipment, but department heads, and that's a backup for departments who don't have it, right? We want to make sure that employees have it, and we want to make sure that if they don't, for some reason their department doesn't have it, HR has some things that we have been stockpiling. And quite honestly, in preparation for an eventual return to the office, we are making sure that we have those products and everything for a safe return to the office. One of the things that we are working on now is some testing of employees that provide essential services. We're working with the vendor now to see if we can have on-site testing of employees who are providing essential services. So those are the steps that we have taken to make sure that our workforce is, to the extent that we can, as safe as possible. As I mentioned, when I've spoken to various sets of employees, these are different, strange, and scary times. And, each person has to take responsibility and charge of their own health. So I can't tell you that you should or should not get tested. And quite honestly, if you feel that you need to be tested, that's what the leave is for. We're providing individuals with that leave so that there's no reason that anyone should feel that they have to come to work feeling ill or concerned that they would not be paid if they did not have the appropriate leave.
Director Barnes.
Council Chair.
Can I recognize Councilwoman Walsh and also
Thank you.
Madam President Hanifa Shabazz, Council Member Congo, and also Councilwoman Yolanda McCoy.
Okay.
Councilwoman Walsh, did you have a question or you just didn't recognize?
No, I just wanted to check in.
Yep, thank you.
Next slide, please. So there was a question around COVID stats, and just as a reminder, we provide an update every week Every Friday, there's a COVID-19 update that goes out to the media from the mayor's office. So it's a global email that provides updated stats on a number of different things related to COVID and upcoming activities, but it also talks about the city workforce and how we have been impacted. I think we've had probably some 160, 70 some odd employees that have been impacted in some way, whether they've been exposed to, required to self-isolate, self-monitor, or self-quarantine. But very specifically, 93 employees have been tested for COVID-19. Of those 93 employees, 77 were negative, 15 were positive, and I'm sorry, that's an X there, that should say 9. 9 of the 15 individuals who have tested positive have been cleared to return to work, and they have returned to work. And the results of one person, one employee that has been tested, their results are still pending. Next slide, please. And the next slide just speaks by department where those 15 positive employees, the departments that they are in. So that's what's listed there to give you a feel for how the workforce has been impacted by COVID-19. So I tried to address the questions that were asked around measures taken, employee education, stats around testing and things of that nature. And I tried to provide some additional information regarding the protocols that we have undertaken. And that concludes my presentation, Mr. Chair.
Thank you. Thank you. And we're going to go to questions. First, Councilwoman Harley, you have a question? Councilwoman Harley? I think you're
Thank
on
you.
mute.
Yeah, I was on mute. Thank you, Mr. Chair. Director Barnes, that was a great update. I was just curious, you know, how they're saying that the majority of those that are more prone to the virus are like 60 years old and older and, you know, having some preconditions. I'm just curious as it relates to the age group in that group that tested positive.
I don't have their ages right in front of me, but I don't believe that demographic, I don't believe that demographic is represented in the people that tested positive.
Oh, okay.
While we do have, you know, a good percentage of our population are over 65, and we did look at that because the initial guidance from the governor's office said if you were over 65, that you were considered high risk. And their secondary guidance came back and said 65 and in a high risk, 65 an underlying health condition. So, but I will tell you that of the employees that have tested positive, I can double check, but I'm fairly certain that none of them were in that age group.
Mm-hmm. Okay, and so that you know, I'm always just trying to you know, confirm, you know, data and information that is already out there. So thank you. Thanks.
Absolutely.
Thank you, Councilwoman Harley. Are there any other questions by council?
I have one question.
Councilwoman Walsh?
Thank you, Mr. Chair. Charlotte, the police officers, do you know if they were mainly patrol?
They were, a good bit of them were. A good bit of them were.
Okay, thank you.
A good bit of them were, yes.
Any other questions by council? Director Barnes, do we have any disinfecting stations around the city out in the parks or any other public areas?
That the city has provided for the public, or the city has provided for our employees?
For both. For both. I mean, I would say it would be for both, especially for employees that are out in the field, that maybe if we have them at the parks, that they can stop and take care of that if they're out and about. So I guess it would be for both.
Okay. Well, for our employees, all of that is provided in their vehicles. So they have gloves, they have masks, they have wipes, they have hand sanitizers. All of that is provided in their vehicles. So that is absolutely provided for the employees. For the public, I would defer to the chief of staff, but I don't recall that we have placed sanitizing stations throughout the city. The only one that I am aware of throughout the city, I recall early on that for the homeless population, we had stations. I believe one was near St. Andrews and Matthews, and I believe the other one was down there at St. Patrick's Center maybe. But there were stations throughout the city where for the homeless population as well.
Thank you. Chief of Staff, Tanya Washington, do you know if we are planning on putting stations out in the public?
That's not come up. I know that we're in the process of distributing masks, but I've not heard about sanitation stations, to be honest with you. I've not heard that.
Yeah, and congratulations on the mask. A question that I wanted to ask: Are we also going to provide three-ply masks and masks that really kind of deter the virus rather than the cloth mask as well?
I'm not sure what the quality of the mask are. I know we received a number of them from various vendors, some from the U.S. Conference of Mayors, some from vendors locally. So I'm not sure if they're like all one mask that is the three-ply that you're referencing.
Yeah, one of my concerns is that we know that the cloth mask doesn't deter anything. So I kind of want to make sure that we are supplying or having some masks. Three-ply would be something that deters the virus, and N95 or KN95s as well. So I just want us to be mindful.
The N95s have been reserved for healthcare workers. It's my understanding the cloth masks work very well. It depends on the actual thickness of the mask. If it's porous and it has a lot of holes, and air can come in and out easily, then that's not the type of mask that you want. And when you're in that situation, they ask you to double up the mask. But the N95s, they have been reserved for our healthcare workers.
That's correct. You're correct. So KN95, you're saying that the cloth mask does deter the virus? Is that what you're saying?
That's what I've been told. It depends on the thickness of it. Not all of them, but it depends on how thick it is.
Okay. Councilwoman Harley, you have a question?
No, I have a comment.
Yes, ma'am.
Just to say that our Surgeon General has said that a cloth mask is better than none at all. And those are his words. And they have recommended that they do matter. And if people don't have anything, if they don't have, like Chief of Staff was saying, those 95s or have been reserved for essential workers, frontline workers, etc. So it's not even, feasible to try to get those masks out. But the cloth masks do work. They do work, and they do matter. Thank you.
So you saying that the cloth mask stops the virus?
I use them myself.
Councilwoman Harley, you said that the cloth mask, the Surgeon General said it stops the virus?
Yeah, I mean, I don't think any put.
Oh, I'm sorry.
Yeah. Know if anybody put a stamp of guarantee, but they said that it does. It does work.
Thank you.
Actually, if I may, Mr. Chair?
Let me go to Council President first, and I'll come right back to you, Councilwoman Walsh. Council President?
Yes, Mr. Chair, I was just saying that it's my understanding that the masks are 3-ply.
Okay, thank you. Appreciate that. Councilwoman Walsh, and then Councilwoman Oliver.
Well, from what I've gotten from the Surgeon General and in listening to him and to all the other doctors on national TV, the masks do not prevent someone from getting this virus.
Right.
It slows people down from getting it, number one. And number two, it does prevent a certain amount that must have to get through for them to end up getting it, but they're not any type of guaranteed prevention from getting it. They're just trying to be another layer of protection for people that even if they do get affected, it will be for a lower grade virus than, the ones that are getting it big. Because if we look at the medical personnel, all the ones that are getting it and dying do have on masks. So I just don't want people to feel invincible because they have a mask on or because, they start feeling comfortable, and I don't need to do that.
Mhm.
Correct. Thank you, Councilwoman Walsh. Councilwoman Oliver?
Yeah, thank you, Mr. Chair. I'm not going to reiterate what they both said, but I was basically going to say that's what I was going to say based on, watching the news and listening to the general and just reading up on the masks in general. It's no guarantee, the masks are no guarantee from getting the virus, but it's just a force of, it's just a stage of enforcement that it prevents you from the next person. If the mask protects me from the next person getting the virus. So I was going to say, I don't think no mask would protect anyone from getting the virus, but I think it's just a shield.
Thank you, Councilwoman Oliver.
Thank you.
Councilwoman McCoy?
Thank you, Chair. My question was, have we achieved the goal of the 20,000 cloth masks?
The 20,000,
Yeah.
I'll try to take that. The 20,000 cloth mask that was in an email today that was distributed, that is an initiative of the working group that includes both council and the administration. I think it came out under Mayor Purzycki and President Shabazz. It's my understanding it's 19,500 masks, so about 500 shy of 2,000. But yes, that 19,500 masks are available.
All right, thank you, Ms. Barnes.
Director Barnes, are you willing, or anyone is willing to go ahead and announce the? I think that press release came out. Is anyone going to announce the areas that it's going to be at this Saturday?
I would defer to Chief of Staff.
Yeah, actually, I'm going to defer to the council president because she'll be there on Saturday. And I don't have the list right in front of me. I wish I had known that. I would have kept the list. I can try to find it. Hold on one second.
Thank you. No rush. We can get back to it. Any other questions from council?
Well, if I could address it, that the press release does detail all of the locations and the contact persons in each of the various districts and areas for where the mass distribution will be. There are going to be some masks being delivered door to door to the seniors whose addresses we were able to accumulate. Most of them were from the individuals that we know that are on the senior identification listing that that's council implemented. Those council members who provided us names of councils of seniors and shut-ins in their district, they were added to that list. The high rises have been tallied, and they will all get the high rise. All high rises we get them for all of those locations, as well as the WHA high rises would get theirs next week, because WHA also partnered with us with this initiative, and they bought masks for all of their residents as well. So all the explicit locations are noted on the press release, and there's a contact person for who is the neighborhood planning councils who are heading those initiatives.
Thank you, Madam President. Chief of Staff Tanya Washington.
Yeah, so I actually have a list of all the locations now, but it's very extensive. I don't know if you want me to read everything, but I'll just give you a couple. For the first district, they're going to distribute masks at the Wilmington Powell, East Lake Park, the North Market Street Library, Speakman Park, Haynes Park, and Crestview. For the third district, looks like Praying Ground Church, and that looks like East 22nd Street. For the fourth district, Herman Holloway Park and Mount Joy Church, being Townsend Street. And for the fifth district, it looks like it's at the intersection of 7th and Washington Streets. And I think that's in the Latin American Community Center. In the sixth district, Jackson Street and Elm, Jackson Street Boys and Girls Club. And for the seventh district, it looks like it's the Unity Church at 2101 Lancaster Avenue.
Thank you, Chief of Staff. Do we have any locations for the second?
Mr. Chair,
do we have anything for the? I'm coming to you, Madam President. Do we have anything for the second district?
Okay, hold on. Let me adjust. I didn't see it on here.
It's none for the second and there's none for the eighth.
Yeah.
If I could, the locations where the masks were to be disseminated was determined by the neighborhoods that were considered to be neighborhoods that had individuals within the poverty level, because they wanted to focus for individuals we felt who have hardest hit to provide masks for themselves and their families. So there, in the second and eighth district, there were not any neighborhoods that were categorized as living below the poverty level. So the second and eighth district were not included in the distribution. And I wanted to say that in the fifth district, it was changed from 7th and Washington to Furling Trotters Park.
Thank you. So, Madam President, we're saying that the second district wasn't nowhere in the second district was below the poverty level to be able to give out masks.
Per the census data that we used to determine the areas, the second and eighth district did not register as having neighborhoods with that we poverty level.
Thank you. Any other questions from council? Seeing none, is there any, look like we don't have any public, so no public comment. Anybody from Director Barnes or Director Williams?
No further comments. Just thank you so much for allowing me to present this information for your consideration. And we certainly stand ready to assist or answer any additional questions you may have.
Yeah, and I'd like to thank all of you. You know, this is a time that probably during your history of working for the city of Wilmington have we been through this. And you know, it wasn't no playbook or strategy that was already available for something like this. So everyone had to scramble on the fly and try to get this together. And we're still learning as we go now. Hopefully the worst is behind us. We pray of that. And hopefully people will continue to stay their distance and remain safe. So I definitely want to give all of you guys kudos for some of the things we had to do in this time of something that was unknown, and we didn't know that we would be a part of a pandemic coming into working for the city. So I like to commend all of you guys for what you have done and the efforts you have done.
We appreciate that.
Thank you, Mr. Chairman.
You're welcome. If there's no other comments from council, I'll go ahead and entertain a motion to adjourn.
So move.
Second.
Second. Okay. All in favor, identify by saying aye.
Aye.
All opposed? Meeting adjourned. Thank you, guys.